upper extremity. Let's go ahead upper. Let's go here. First one. Whatever muscle that help to rotate the shoulder, we call it rotator cuff muscles. Okay. There's only 4 muscles. You have the mnemonics and everything, everybody knows. Now, when it comes to rotator cuff, there's only 2 pathology you can possibly get. One is called rotator cuff tendonitis or rotator cuff tear. Rotator cuff tendonitis or tear. These are the 2 possible pathologies in rotator cuff. Now, when it comes to these 2 diseases, both gives a similar pain and stuff. So how do you diagnose? We give them lidocaine injection. We give a lidocaine injection to the shoulder. If they feel better after lidocaine injection, it's tendonitis. If they don't feel better, that's a tear, which requires surgery. Which makes sense. Injection cannot fix a structural problem. Is that clear, folks? So injection can only shut down inflammation and all those things, folks. Okay. I gave you the most filtered information you can possibly learn in this shoulder, folks. If you know this too, you cannot go wrong. Okay. So lidocaine injection makes tendonitis better. Tear will not get better because it's a structural tear. So you have to surgically fix it, folks. Okay. So that's that. Is everybody clear? Okay. Now, let's talk about arm abduction. Everybody missed this question, folks, because I know where they go wrong. What does abduction mean? If I ask you to do abduction, how do you do? This is abduction. Is that clear, folks? So basically going up is abduction. Now, if I'm standing here, if I'm going like this, look at that. The first 15 degree, this much, let's say this is the first 15 degree. It's actually done by supraspinatus muscle and the suprascapular nerve. Okay, because when I say abduction, the first thing everybody thinks is axillary and deltoid, isn't it, folks? Everybody think, but you have to be very careful. The first 15 degree is supraspinatus and suprascapular nerve. Is everybody clear? After 15 degree, like this, then whatever I do is deltoid. After 15 degree, it's deltoid, which is innervated by axillary nerve, folks. Oh, especially, if you guys go to gym and work out, they always tell, right? All the guys want to develop the deltoid muscle, right? So they say, in order to develop the deltoid muscle, we don't have to go all the way from here to here. We could keep the hand in this position because that's the first 15 degree, which is not deltoid. Does that make sense, folks? So from here, if you do, that's the pure deltoid development. So you don't have to come closer and go because you are exercising a different muscle. Does that make sense, folks? So always remember the first 15 degree is different muscle, 15 to 90 is the next one. Is everybody clear, folks? After 90 degrees, so let's say this is, then if I go further, that's trapezius. And that's your accessory. And then you have serratus anterior also work with trapezius. That's long thoracic nerve. Question comes on the exam. Patient comes with the shoulder problem, and during a physical exam, initially he has difficulty, but then he is able to do abduction. Answer is suprascapular nerve damage. Is that clear, folks? Initially he has difficulty, that's first 15 degree, then he has no problem. Or the question can be other way around. He starts abduction, but after a moment he couldn't continue. That means axillary is affected after that. Is that clear, folks? So always remember, because that's how it works. So that's your arm abduction nerves. Is everybody clear, folks? All right. So that's that. Now let's go. Now let's get some other important. Let's get carpal tunnel. One of the most important topic for upper extremity, right? Look at this picture. It's basically a glass piece. You cut the wrist. This is what you see. So this is your posterior surface. This is your anterior surface. Okay, posterior and anterior. Now inside, you have carpal bone. They're only showing 5 bones here, folks, but we know there's 8 carpal bones. Okay. Now inside, there's a tunnel we call carpal tunnel. Why do we call it carpal tunnel? Because it's in between the carpal bone. So that's how the name comes, carpal tunnel. Okay. Now we need to learn the boundary. Carpal tunnel is protected by bones on the posterior side, and the anterior side, we have this layer, what we call flexor retinaculum. You need to know that it's flexor retinaculum. It has another name, transverse carpal ligament. I was told that in the exam, they don't use the word flexor retinaculum, but they use the word transverse carpal ligament. So even if you know flexor and if you don't know it has another name, you are done. Okay, that's transverse carpal ligament. That's anteriorly, it's protecting. Is everybody clear, folks? Now inside the carpal tunnel, there is about 9 tendons totally. Okay, you could count 1, 2, 3, 4, 5, 6, 7, 8, 9. 9 tendons are there with 1 nerve. That's your median nerve. Is that clear, folks? So inside the carpal tunnel, you have 9 tendons and 1 nerve, which is your median nerve. Anytime a compression happens to median nerve inside the carpal tunnel, we call carpal tunnel syndrome. Is that clear, folks? So the definition of carpal tunnel syndrome is the median nerve is getting constricted or compressed. That's carpal tunnel syndrome. Is everybody clear, folks? That's the idea. Now, coming back here, you could see all the carpal bone, right? Scaphoid, lunate, trichotrium, pisiform, trapezium, trapezoid, capitate, hamate, all this now, whatever. Good thing you don't need to remember the names for the exam. But what you need to learn, this one. Of course, I talked about scaphoid, that's avascular necrosis. This is your anatomical snuff box. You all have anatomical snuff box, right? If you put a needle through that, it touches the scaphoid bone. Is everybody clear, folks? The next thing you need to learn for the exam, hamate. Hamate bone is very important. It has a hook. That bone has a hook, and there's a nerve that runs right next to it. That nerve is called ulnar nerve. Okay. That nerve is called ulnar nerve. I'm going to come to that. The hamate hook and the nerve is called ulnar nerve. Okay, we'll talk about that in a few minutes. Okay, now I'll come to that ulnar. Don't worry about that. We will come to that. Okay, so we talked about the carpal tunnel and carpal tunnel syndrome. Let's go find out what's happening with carpal tunnel. Did I skip? Oh, yeah. Go find the page 468. Okay. Now, when we talk about carpal tunnel syndrome, first let's learn the theory. Entrapment of median nerve in the carpal tunnel between the flexor retinaculum and carpal bones, and the nerve compression happens. Is everybody clear, folks? All right. Now we need to know what's the function of median nerve. Median nerve innervates first, second, third, and half of the fourth. Is that clear, folks? That's why we call 3.5, okay? So first, second, third, half of the fourth finger. They innovate that. They also innovate this. What is this area called? That's a thenar area, and this is hypothenar. Is that clear, folks? This is thenar and hypothenar. You could feel your hand. Try to feel it. It's very strong. That's because your median nerve is innervating and the muscles are well developed. Okay, the muscles are well developed, folks. Okay, that's thenar area. Now, anytime you compress the median nerve is compressed right here, so nothing can happen in the hand. Is that clear, folks? So which means your sensation 3.5 is affected, and the muscles of the thenar is going to be atrophied. Look at that. It's atrophied here. Do you see that? That's called thenar atrophy. So patient has paresthesia, pain, and numbness in the distribution of median nerve. So no sensation of the anterior part, 1, 2, 3, half of the fourth finger. Is that clear, folks? Okay, that. And then, thenar atrophy. Okay. But the most important people go wrong. In the thenar area, the sensation is still spared. Okay. So if I have a carpal tunnel patient comes to me, I take a needle and I poke right here, they still feel it. Because the palmar cutaneous nerve that innervates this area, watch me carefully. The palmar cutaneous nerve that innervates this area, it comes out of the carpal tunnel before it goes through the carpal tunnel. Before it enters, the branch come off, so that branch is not compressed. Is that clear, folks? Important. They have a beautiful picture on UWorld. I'll show you, but that's very important, okay? This is the one thing that I will learn. That's what we call studying smart, because they would always ask you that one exception, guys, okay? So palmar cutaneous enter the hand prior to the carpal tunnel, folks, okay? So the median nerve branch will come off before it even enter the carpal tunnel. So even if the carpal tunnel is affected, that particular nerve is not. Is that clear, folks? All right. So that's the key for carpal tunnel syndrome. Now, how do we diagnose somebody with carpal tunnel syndrome? Two things. We could percuss here. If you press, it hurts. Or you could see the other one called Phelan maneuver. If you keep your hand like this, 90 degree, you shouldn't have any pain. If I'm keeping it at 90 degree and if you have a pain, that means you have a problem with the median nerve, folks, okay? Now, what are the conditions that causes carpal tunnel syndrome? Pregnancy can cause. Rheumatoid arthritis, we talked about yesterday. What does rheumatoid arthritis do to the carpal bone? It causes all the 8 bone to fibrotic. They fuse together, isn't it, folks? When they fuse, they compress. Hypothyroidism, diabetes, acromegaly. Look at this. All of them can cause this. Everything requires surgery. What do we do in surgery? It's a small surgery. We cut here, go inside, decompress. We kind of release the compression. Everything requires surgery except pregnancy. You don't have to do surgery for pregnancy people who gets carpal tunnel, because once they deliver the baby, all the fluid will go away. So that means it will get better on its own. Is that clear, folks? Except pregnancy, everybody else requires surgery. So that's called carpal tunnel syndrome. Are we good? Next, I'm just going in there to the previous picture to show you guys. Let's see here, right? That's carpal tunnel. Let's clean this up. Okay. Now, next, there's another canal here outside the carpal tunnel. It's called Guyane Canal. Now, in Guyane Canal, all you need to know, the ulnar nerve is inside. Okay, the ulnar nerve is inside. So whenever the ulnar nerve is compressed, we call Guyane Canal syndrome. Is that clear, folks? Now, the most important here, we already talked about it. Look at that. What did I say? Hamate has a hook. Next to the hook, you have ulnar nerve, right? Anytime there is a fracture to this bone, look at this, fracture of the hook of the hamate can cause ulnar syndrome, which is your Guyan canal syndrome, because that will damage or compress the ulnar nerve, because this bone is here, ulnar nerve is right next to it. When they fracture, they compress that. Is that clear, folks? Now we need to talk about that, right? Let's go here. Guyan canal syndrome. Now you want to learn something important here. In USMLE, they will tell patient was riding on a bicycle and he fell on top of the bicycle handle. Okay, he tripped or whatever happened, he fell on top of the bicycle handle. Which of the following abdominal organ is damaged? Answer. Type it up. Which organ is damaged or ruptured when somebody fall on top of the bicycle handle? I think did I mention this before somewhere? I did, right? I have a deja vu. I feel like I did it, but I don't know. Okay. The answer is pancreas. Okay. Why is it specific? Think about, folks. Bicycle handle is like this, right? Imagine if I am falling on top of the bicycle handle, I am falling literally like something hitting horizontally. Your pancreas is like that. Is that clear, folks? I cannot hit my spleen because spleen is protected by ribs. So nothing can compress. When we call blunt abdominal trauma, that's something different. When you have a blunt abdominal trauma, spleen is the number one organ to rupture. Okay? When you have a blunt abdominal trauma, but not when you fall on top of the bicycle handle. Okay? You shouldn't even think of spleen now because this is the second time I'm talking about this. I told you this. NBME has this question. Everybody picks spleen. No, it's a bicycle. I tell them specifically bicycle, that handle horizontal shape damages the pancreas. Number two, when you fall on the bicycle handle, there's a higher chance to hit right here because you're holding the handle. That always fracture the hamate bone. Is that clear, folks? So whenever you fall from the bicycle, pancreas and hamate. Look at this. It's all bicycle injury. Is that clear, folks? So if I say it's a trauma related to bicycle, it's either ulnar nerve or pancreas. Is everybody clear, folks? You cannot miss that. Ulnar nerve or pancreas. Okay, that's the idea. Look at this. It's all there, folks. It's the hamate and stuff. So, okay, that's the idea. So give me